Hi, my name is Jared Barker, and I am completing my discussion for this week for Psychology 112. This is a picture of me when I went to visit my sister this past summer, so it's a little bit of an old, but this kind of shows you what I look like. The job and the career that I intend to pursue is neuropsychologist. Is that of a neuropsychologist, I should say. I should say, excuse me. The main job focus of a neuropsychologist is identifying the relationships between the brain structure, functions, and the emotions that we have. They also identify any disorders like behavioral disorders or cognitive and other mental abilities. So they do this in a couple settings. A neuropsychologist who works in a lab conducts more experiments or gathers the results and data from said experiments and publishes those results so that other neuropsychologists can check and see if those results are valid. The other setting is that of a clinical setting. Neuropsychologists in this setting would evaluate individuals who show signs of brain injuries or have abnormal brain functions. This can be whether they've had a stroke or they have Alzheimer's disease or other similar diseases, just to give you an idea of what they do in a clinical setting. They also will run tests, that are focused on memory or concentration or the mood of a person or personalities. They will oversee MRIs and PET scans, and they'll work closely with medical professionals to find treatments for patients if they have mental problems or stuff like that due to brain injuries. They can also be neuropsychologists can also be asked to help in a legal setting. If a person is injured and they develop complications mentally, then a neurologist or a neuropsychologist may be called in to help give an opinion about it. Likewise, if an individual is claiming that they have mental problems and they've committed a crime, a neuropsychologist might be called in to give an opinion on whether or not they have one or not. The education required for a neuropsychologist is quite a bit. So you have to complete your undergrad, and to do this, you have to major in psychology, neuroscience, biology, or pre-med. Any one of those will be fine. Then you have to go and complete a master's in neuropsychology or neuroscience and any other closely related field. Most jobs, however, are going to require that you have a doctorate, and that usually takes 3 to 7 years to complete, and then you have pre and postdoctorate studies that are supervised. To be certified, you have to complete a doctorate program from an accredited institution. That you also have to have your internships and your residencies. You have to show that you are capable with neuroscience, neuropsychology, neuropathology, psychology, pathology, and psychological pathology. So my 4-year plan, I'm majoring in psychology. I intend to add neuroscience and biology classes into my plan. From there, I intend to talk to my professors, and I have already done so, about getting letters of recommendation and learning more about the field that I'm going to be going into. I will be pursuing a PhD in neuropsychology, specifically clinical neuropsychology, and then I'll be going and getting certified. So I could change this and go into the medical field if I wanted to, however. The reason I'm majoring in psychology is because I have a lot of friends and family who have and do suffer from disorders, and some of them are not very well known, some of them are, but there's so much more to learn about this particular field that it's fascinating to me, and I just really want to learn more about it to where I can help people. Compared to why other people major in psychology, like I said, I'm similar to other people in the sense that a lot of us are interested in psychology and what it is and how people are affected by psychology or mental health issues. I'm not majoring in this because it's easy or anything like that, or because it's a good career, it's going to pay a lot of money. That's not the reasons. I'm more interested in just learning about what psychology is, the mental aspects of it, and learning more about what isn't known, and hopefully helping people along the way. So that's my power presentation. Thank you.